Hello, Ms. Bustillos. My name is Janet Rodriguez, and I'm going to be just interviewing and asking you a couple questions regarding Dr. Pat. The first question would be, what is your medical problem? And I understand you had cancer, so what type of cancer did you have?
Breast cancer, and it metastasized after 5 years into my spine.
Okay, now now that you're in remission, what type of medical problem do you have?
I have ambulatory problems getting around, walking.
Mm-hmm.
It seems like maybe my walker is starting to give me a problem as far as my pressure on my shoulders and that kind of thing. I'm having a problem with pain, evidently.
Okay. Now, how did you find Dr. Pat Warden?
From my primary physician.
Okay, so he referred you to him?
Yes, he referred me to Dr. Pat Warden.
Okay. And now, at that time, it was due to the breast cancer?
It was due to the breast cancer, and it was a lump, and Dr. O in Chino, he was the one that did the surgery, and he took the lump from my right breast, so it wasn't a mastectomy. It was just a lumpectomy.
Okay. Now, how long have you been Dr. Pat Warden's patient?
17 years at least. 17
years, okay. And what problems have you encountered due to the restrictions that have been placed on Dr. Pat?
I haven't incurred any problems at all due to the fact that it would cause me to have any hard feelings toward Dr. Pat at all.
Okay. Now, what about when you filled your prescriptions a couple times?
There was a couple of times, but it wasn't anything that we couldn't get around because he still has a very loyal physician in his office, Heidi Lawson, and so we're able to get the physicians through her if I can't get them any other way. Okay, so then he's giving you that convenience to you. So yes, so it wasn't that inconvenient. Okay. Now, last but not least, but are you happy with Dr. Pat, the treatments he's given you? If you didn't see him, what would you have done? I would have waited for him to give me his instructions because I trust him explicitly. But what if you never met him? I mean, do you think where do you think you'd be now? If I met him right now and I hadn't met him before, is that what you're saying? Yes. Like on breast cancer. I wouldn't have any way of measuring that kind of relationship if I hadn't met him before. Okay. Now, I'm very impressed with Dr. Pat, but I've known him for 17 years, so it's kind of hard to know exactly how I would have. You're talking about his problems that he's been having recently, or it's hard to measure that because I've known him so long before, and I've known him after. So I'm very loyal to Dr. Pat, so it's really a hard question for me to answer. Would you change doctors if they told you to? Oh, or? I've already been faced with that, and no. Okay, so you're very loyal. I'm very loyal to Dr. Pat. I love Dr. Pat. Okay. All right. Is there anything else you would like to add for Dr. Pat? Well, one thing that I said one time that was impressive to the people that heard it was, I said that if Dr. Pat give me poison, I'd take it, and I would, because chemotherapy is poison. I mean, it's the right. If Dr. Pat didn't know what he's doing, it could easily kill somebody because he's got to know what he's doing. So he's very loyal to us too. So it's reciprocal. Okay, so you give him that trust. You have a lot. Absolutely, explicitly, yes. Okay. Well, thank you very much, Ms. Bustillos. Again, if you'd like to add anything, you can just go ahead and say now, or the office is there for you at any time for your help. Already, he doesn't close shop. Dr. Pat's always there if his patients need him. I have never met a doctor as good as Dr. Pat is, because one time I needed a ride I called up Dr. Pat and told him I couldn't get a ride because I was living in Fairmont and his office is in Upland, and I told him, Dr. Pat, I can't make my appointments, and he told me, I'll come and get you. I mean, he didn't hesitate. He said, I'll come and get you. And he didn't even hesitate either. He said, and if you need medicine, I'll bring them to you, he said.
So you for sure know that he would go out of his way for any patient?
Absolutely, absolutely. There's no question about it. I mean, because he's willing to do that's what I've always done for my jobs too. I'm willing to go the extra mile, you know, and Dr. Pat is that way. He's willing to go the extra mile, whatever it takes. You know something too? When I was in transition and I was thinking about looking for a place to live, and he said, I've got a big house. He said, if you need a place to live. He actually told me that, but I would have never imposed on him that way. But I'm saying the man he's good. He's got a wonderful heart, and he's a really good physician. Some doctors, they're physicians with a pocketbook, but not Dr. Pat. Not Dr. Pat.
That's very wonderful for you to say. Well, thank you again, Ms. Bustillos. You have a good day. Thank you.
Thank you. Thank you for coming.
Thank you.